Let's bring in Stanford Health physician Dr. Alok Patel for more on the holiday travel and these concerns over more spreading of COVID-19. So many people, Dr. Patel, look forward to the holiday weekend because of spending time with friends and family. So do we really have to give that up again?
Well, Diane, it's not necessarily about giving it up. And I'm one of those people who would look forward to traveling and having some fun. But we have to assume this a little bit more of a community mentality. If you want to go out and travel, try to pay attention to where you're traveling to, what community transmission and vaccination rates look like when you're there. Make sure your entire group is on the same page. Who you're traveling with, who you're going to go see regarding vaccines, masks, and that stuff. And last but not least, we've been talking about this since last year, pre-vaccination, is get tested before you go. And when you come back, get tested again, just to make sure you're not bringing anything back to your community, to your families and your loved one.
So what do you make of this surge in cases in Texas schools and pediatric hospitalizations? Do you think parents need to think twice about sending their kids back to school?
I think parents need to think twice about where they stand if they have any concern about masks or vaccinations. Because, Diane, this is not surprising that we're seeing a higher rate of infections and hospitalizations in states that are a little bit more lackadaisical with what we need to do to prevent the pandemic. There's data coming out now showing that cases are 4 times higher. So hospitalization rates are 4 times higher in states with a lower vaccination rate. So what I think parents should do is it's incumbent on them to keep their kids safe and to go and check out your school. Look to see what those restrictions look like. Look to see what they can do to keep their kids safe with regards to ventilation, to masks, to vaccines, to all of it. Because as we know, we can't always depend on our governors to do the best thing for kids.
Now, Dr. Fauci says there's evidence that this new Mu variant slightly evades vaccines, but it's not an immediate threat. So how concerned are you about this? How concerned should we all be?
I think we should try to put ourselves back in the shoes of where we were at the beginning of this year when this is what was being said about the Delta variant. And there was no real way to know back then what direction that was going to go. So Dr. Fauci is correct. The Mu variant, which is present in 39 countries, there's early kind of a thought that it might be able to evade some antibodies, which could spell trouble. But why don't we think about what could happen if we let another variant do what Delta variant did to us? And I hope that motivates people to take this more seriously, especially those who aren't still taking it seriously after a year and a half.
An FDA advisor now says a 2-dose vaccine appears to be enough to curb infection without adding a booster shot. So does that contradict what we've heard from other public health officials? And why aren't we seeing the booster shots go through the kind of standard practice that we've seen for the vaccines themselves?
Dan, that's a loaded question there with a lot of I don't knows. But I do kind of agree with what Dr. Paul Offit, who actually made that comment, about where he was coming from. And it's not necessarily that a third shot or a third booster or a third shot in this immunization series is useless per se. It's that we know that high vaccinated areas are less likely to see community transmission and hospitalizations. So it would be better for us to be focusing on vaccinating the unvaccinated and achieving global equity. We'll just have to wait and see what happens on September 17th when the community gets together and looks to see who actually should be out there getting a third shot. Now, with regards to why this process hasn't rolled out in the same way it was earlier when vaccines were authorized, that is a big question. And I think that's what led to a little bit of that internal frustration we saw earlier with the FDA. But I think that meeting on the 17th is going to be clutch.
And absolutely nothing wrong with saying, I don't know, every now and then. We should probably all say it a lot more often. Dr. Alok Patel from... What's that?
It's honest and it's humbling.
Hey, listen. It's accurate, which is what we aim to be here. And Dr. Alok Patel, that's why we love having you. Thank you so much. Have a great weekend.
Happy Friday. Thank you, Diane.
Hi, everyone. George Stephanopoulos here. Thanks for checking out the ABC News YouTube channel. If you'd like to get more videos, show highlights, and watch live event coverage, click on the right over here to subscribe to our channel. And don't forget to download the ABC News app for breaking news alerts. Thanks for watching.